29-year-old Rita Chieti suffers from anemia. Anemia is a blood condition that affects the body by limiting the supply of oxygen to the body's cells. Hematologist Dr. Dominic Amato.
The symptoms that may develop in anemia are a result of having a low amount of oxygen being delivered to the tissues. Things such as getting tired easily, getting short of breath on exertion, headaches or a pounding feeling in the head, weakness, or just not feeling well.
Circulating blood is the delivery system of the body, carrying oxygen and nutrients to the body's tissues and carrying away waste products. It also plays a vital role in the immune system. Blood is made up of fluid that carries salts and minerals and 3 types of cells. Platelets, the small cells in this electron micrograph, are the cells that make blood clot. White blood cells detect and fight infection. Red blood cells are the 3rd type. These are the cells involved with anemia.
These are the cells in the blood that help carry oxygen to the various parts of the body. And when these are low, this is what we refer to as anemia.
Blood cells are manufactured in the bone marrow. Red blood cells are replaced approximately every 90 to 120 days. The protein hemoglobin is a vital component of a red blood cell. Problems with hemoglobin are a common cause of anemia.
The hemoglobin molecules in the red blood cells are able to pick up oxygen. It just diffuses from the lungs into the red blood cells.
Anemia can have several different causes. The amount of hemoglobin, and therefore the oxygen-carrying capacity of the blood, can be determined by a simple blood test.
Hemoglobin can be measured in the lab by taking a small amount of blood and actually disrupting, breaking open the red blood cells in that blood and measuring the amount of hemoglobin that's in them. Also, putting the blood on a slide and staining it and looking at it under a microscope is usually very helpful in trying to determine which type of anemia a given person might have. Because the red blood cells are produced in the marrow, in the bone marrow, it's sometimes helpful to do a bone marrow examination in order to diagnose the anemia, the specific type of anemia. In most cases, this isn't necessary, but sometimes it may be.
An important element in the production of hemoglobin by the body is the mineral iron. Iron is what makes blood red. An iron deficiency is a common cause of anemia. Rita's anemia was caused by a lack of iron in her diet. Iron is found in high levels in red meat. Rita was a vegetarian for several years.
I had not eaten meat in about 10 years. I was the occasional red meat eater, but it wasn't part of my diet. I didn't think in terms of, going out and buying steak or red meat or anything like that.
One could be losing blood. For instance, young women who have very heavy menstrual periods often become iron deficient. People who have ulcers or various disorders of their intestines or stomach might bleed small amounts chronically and become deficient in iron in that way.
Pregnant women can also occasionally develop anemia. When a woman is pregnant, there is an increase in blood volume to nourish the developing baby.
When women are pregnant, the nutrients that they have in their body are first used for the developing fetus. And the fetus has first call on any iron that might be around.
For these types of iron deficiency anemia, a change in diet to include more iron or supplements in the form of tablets can often correct the problem.
I've been taking them for about 2.5 months. I'm eating more meat. I'm forcing myself to every day or every other day to have something red or chicken or liver or whatever, and I feel much better.
In addition to iron, the manufacture of red blood cells in the bone marrow also requires the elements vitamin B12 and folic acid. Anemia can result from a deficiency of these 2 compounds. Both vitamin B12 and folic acid are found in meat. Folic acid is also found in leafy green vegetables, especially in spinach. A change in diet may be prescribed, or patients may be given supplemental tablets or injections of B12 and folic acid. Another type of B12 deficiency is called pernicious anemia, where people have B12 in their diet, but their body can't absorb it.
Thank you very much.
In the olden days, this type of anemia was in fact pernicious, i.e. deadly, but nowadays it can be treated quite easily with injections of B12, and a person can be normal for the rest of their life.
This man has another form of anemia called secondary anemia. He has myeloproliferative syndrome, a disorder of the blood-forming mechanism. Secondary anemias can result from a number of diseases.
There is another disease present in the patient, for example, a chronic infection or a chronic malignancy or something of that nature, which is upsetting the normal balance of the body and producing an anemia on that basis. In those cases, really, if the underlying disorder can be corrected, then the anemia usually improves spontaneously. If the hemoglobin is very low, a transfusion could be given to raise the hemoglobin level.
A transfusion of 1 unit, or 450 milliliters of red blood cells, takes 2 hours. Before the transfusion, the cells are carefully matched for blood type to ensure they are compatible.
However, this is just a temporary solution because the red blood cells have a certain lifespan. It's only about 3 months or so. And those transfused cells will eventually live out their lifespan. So unless you can get at the root of the problem, a transfusion is not a definitive solution.
Another group of anemias that result from problems with the blood cell forming mechanism includes sickle cell anemia and thalassemias.
These are disorders in which there is some abnormality of the production of hemoglobin, which is hereditary. There is something wrong with the genes that are responsible for producing hemoglobin, where either an abnormal type of hemoglobin is made or not enough hemoglobin is made.
Sickle cell anemia is most common among blacks. This disorder involves attacks of symptoms that often require hospitalization to relieve discomfort. Thalassemias are most common among blacks, Mediterraneans, and Asians, and often are treated with transfusions. Connie Girardi is 21. She has a rare form of anemia called autoimmune hemolytic anemia. It results from a malfunction of the immune system.
For some reason, which we don't really know, a person may make antibodies against their own red blood cells, and by so doing, destroy those red blood cells. There are other types of hemolytic anemia, too, that do not involve antibodies. Hemolytic means breaking up or destroying the red blood cells.
These rare anemias could be congenital or caused by drugs or problems with blood vessels or a number of other causes. Autoimmune disorders can be treated with medications that suppress the immune system. Connie took a drug called prednisone that induces remission of the disease. While on medication, there can occasionally be side effects.
They made me blow up, a lot of acne, cold sweat, made you hungry, you're moody. You know, you just want to be by yourself.
After a remission has been achieved, there is a likelihood that the disease will reappear, requiring further treatment. There are many possible causes for anemia, though the symptoms, fatigue, shortness of breath, dizziness, are common to most. An accurate diagnosis is needed before the appropriate treatment can be given.
You hang in there and you deal with it because it will come to an end. You will get better and you'll feel a lot better.